Welcome to Chapter 10, Treatment Planning, Clinical Assessment, Intake, Consent, and Documentation. In this chapter, we will explore the professional and clinical responsibilities involved in preparing for safe and effective massage therapy sessions. Massage therapy begins long before physical contact occurs. Proper intake procedures, communication, assessment, informed consent, documentation, and treatment planning are all essential parts of professional massage therapy practice. As future massage therapists, students must understand that professionalism, communication, and clinical reasoning are just as important as hands-on treatment techniques. Learning objectives. By the end of this chapter, students should be able to 1. Explain the purpose of treatment planning and documentation. 2. Demonstrate proper intake and communication skills. 3. Identify contraindications and red flag conditions. 4. Develop appropriate treatment plans. 5. Complete SOAP note documentation. 6. Demonstrate professional clinical conduct. These skills help ensure safe, ethical, and professional massage therapy practice. Clinical reasoning. Proper assessment leads to a solid treatment plan that leads to effective treatment with positive results. Massage therapists must evaluate 1. Tissue condition, pain presentation. 2. Contraindications. 3. Client goals. 4. Stress levels. 5. Safety considerations. Every client presents differently. Massage therapy should never become a routine sequence performed the same way for every client. Clinical reasoning allows therapists to adapt treatment safely and effectively based on the client's individual needs and presentation. Documentation and intake. Documentation is an essential part of healthcare practice. Proper documentation helps protect the therapist legally, support continuity of care, track client progress, improve communication. The intake process identifies health history, contraindications, medications, client expectations. Remember, if it is not documented, it did not happen. Accurate documentation helps ensure safe and professional massage therapy treatment. Pre-session personal history form. This pre-session personal history form is used before massage treatment to help gather important client information related to health history, contraindications, treatment preferences, and session safety. Students must review this form carefully with every client before beginning treatment. This form helps maintain accurate client records and communication. The form also asks whether the client has previously received massage therapy and identifies the client's preferred massage pressure, including light, medium, and deep pressure. Students should always discuss pressure preferences with the client and remember that pressure may need to be modified depending on medical conditions, pain sensitivity, contraindications, tissue presentation, and client comfort. The form also identifies areas of pain or tension, including neck, shoulders, upper back, lower back, arms and hands, legs and feet. This helps guide treatment planning and focus areas during the session. Clients are also asked about preferred massage treatment options, such as full body relaxation massage, prenatal massage, foot reflexology, student and instructor recommendations. The form also screens for important conditions that may require modifications or contraindicated massage treatment, including sunburn, inflammation, open cuts or wounds, bruising, irritated skin or rash, headache, fever, pregnancy, and cold or flu symptoms. Students must carefully review these responses before beginning treatment. The medical history section asks about diagnosed medical conditions, recent surgeries or procedures, and prescribed medications. Additionally, students should pay special attention to medications and health conditions that may affect circulation, sensation, inflammation, bruising, pain perception, and treatment safety. The form also includes an additional notes section where clients may indicate areas to avoid, areas to focus on, and specific requests or concerns. This information helps improve client comfort and individualized treatment planning. At the bottom of the form, clients review and sign important clinic acknowledgments, including massage therapy is not a replacement for medical care. No diagnosis will be made. Cancellation policies, draping procedures, instructor assistance policies, and professional conduct expectations. Students should ensure all required sections are completed. Signatures and dates are obtained. Forms are reviewed before treatment begins, and all documentation remains confidential and securely stored. Proper completion and review of intake forms are essential parts of safe, professional, and ethical massage therapy practice. Intake History Form Back Section. The back section of the intake history form is used for ongoing documentation and treatment updates. This section may include session notes, objective findings, treatment plans, contraindications, home care recommendations, and SOAP note information. Students are responsible for completing documentation clearly, professionally, and accurately after each treatment session. Next, effective communication and rapport. Professional communication helps establish trust, comfort, safety, professionalism, and therapeutic rapport. Therapists should greet clients professionally, listen actively, maintain eye contact, and explain procedures clearly. Strong communication skills help clients feel safe, respected, and comfortable throughout the treatment process. Proper client greeting. Students should greet clients professionally by introducing themselves clearly. Example: Hi, my name is, and state your name. I will be your student massage therapist for today. The student should then ask, have you been here before? This helps determine whether new paperwork or updated forms are required before treatment begins. A professional greeting helps establish trust and confidence from the start of the session. New and returning clients. New clients should receive the pre-session intake form. Returning clients should be privately asked if there is anything new since the client's last visit. Any additional changes, treatment modifications, or requests should be noted in the form containing client update/progress notes. Students are required to become familiar with the school's clinical documentation and know how to properly complete and store forms securely. Other forms may be used in a clinic setting depending on the requirements, including incident report forms and confidential information release forms. Returning clients may be required to complete updated intake forms if previous records are outdated and afterwards professionally escorted to the treatment room. Confidentiality and reception area professionalism. All confidential discussions must occur inside the treatment room and never in the reception area. Students should avoid discussing with clients publicly, remain professional, and avoid unnecessary conversations in reception areas. Protecting client privacy is both an ethical and legal responsibility. Professional behavior in public clinic areas helps maintain trust and professionalism within the healthcare environment. Health update before treatment. Before treatment begins, students should ask, is there anything that I should know about your health today that could be a contraindication for massage or require specific considerations or modifications during the session? This question helps identify injuries, illness, medication changes, pregnancy, and areas requiring modifications. Students should carefully review all updated health information before proceeding with treatment. Draping and positioning instructions. Before leaving the room, students should explain preparation instructions clearly and professionally. Example: before I step out for you to get ready, I would like for you to disrobe to your comfort level, lie face down on the table, cover yourself with the top sheet, and place your face in the face rest. Do you have any questions? Clear instructions help reduce anxiety and support proper draping procedures and professionalism. Re-entering the treatment room. Before leaving the room, students should explain the re-entry procedure. Example: I will give you a couple of minutes and knock on the door before entering to make sure you are ready. Students must always knock before entering by saying the client's name to make sure the client is ready, respect privacy, and maintain professional boundaries. Respectful communication helps create a safe and professional therapeutic environment. Communication during the session. Professional communication should continue throughout the massage session. Therapists should check pressure, explain position changes, discuss comfort levels, and maintain professional tone. Example: is the pressure comfortable for you in this area? Ongoing communication helps improve client comfort, safety, and therapeutic effectiveness. Next, topics to avoid. Therapists should avoid political debates, inappropriate jokes, offensive language, discussing other clients, and excessive personal sharing. The focus should remain on the client's comfort, professionalism, and therapeutic goals. Maintaining professional boundaries is an important part of ethical massage therapy practice. Client comfort, safety, and professional boundaries. Clients should always feel safe, respected, comfortable, and professionally cared for. Massage therapists should explain procedures clearly, ask permission before working sensitive areas, check pressure and comfort regularly, maintain proper draping, respect personal boundaries, and allow clients to stop treatment at any time. Students should never assume a client is comfortable with pressure, positioning, silence, stretching, and certain areas of touch. Professional communication and respectful treatment procedures help create a safe, comfortable, and client-centered massage experience. Informed consent. Clients should understand treatment goals, techniques used, possible risks, expected benefits, and the student's ability to request instructor assistance if needed. Clients always have the right to stop or modify treatment at any time. Informed consent supports ethical, professional, and client-centered massage therapy practice. Scope of practice. Massage therapists may perform massage therapy, provide stretching, and use hydrotherapy applications. Massage therapists may not diagnose diseases, prescribe medications, perform surgery, and perform psychotherapy. Students should always follow the massage therapy licensure regulations for the state in which they practice. Red flags and contraindications. Massage may need to be postponed or modified based on local or systemic contraindication. This may include fever, infection, severe inflammation, chest pain that could indicate a medical emergency, suspected DVT, recent fractures, and neurological symptoms. Client safety should always remain the highest priority. Students must recognize contraindications and seek instructor assistance when necessary. Now, the importance of pain assessment. Pain assessment evaluates severity, location, duration, aggravating factors, and relieving factors. The OPPQRST system may be used during assessment to gather detailed information regarding the client's pain presentation. Accurate pain assessment helps guide treatment planning and technique selection. OPPQRST system. The OPPQRST system is a structured pain assessment method used to gather organized information about a client's symptoms. O stands for onset. When did the pain begin? P stands for provocation and palliation. What makes the pain worse or better? Q stands for quality. How does the pain feel? R stands for region and radiation. Where is the pain located, and does it travel? S stands for severity. How intense is the pain on a scale from 0 to 10? T stands for time. How long has the pain been present, and how often does it occur? Using the OPPQRST system helps improve assessment accuracy and clinical interpretation. Postural and functional assessment. Massage treatments are composed of proper clinical assessment in order to create an appropriate treatment plan that would provide positive results. Therefore, massage therapists should observe forward head posture, rounded shoulders, pelvic imbalance, gait abnormalities, movement restrictions, and muscle guarding. Assessment findings help guide technique selection, pressure selection, positionings, and treatment planning. Careful observation helps support effective clinical decision-making. Treatment planning. In order to create a proper treatment plan, students should consider client goals, health status, contraindications, assessment findings, and tissue condition. Treatment plans may include techniques selected, session length, and home care recommendations. Treatment planning helps create individualized and goal-oriented massage therapy sessions. SOAP Notes form. This slide demonstrates the SOAP note form used within the student clinic setting. Students must become familiar with documenting treatment findings, recording objective observations, writing treatment plans, and documenting follow-up recommendations. Professional documentation is an important responsibility in healthcare practice. HIPAA and confidentiality. Massage therapists must protect client privacy, store records securely, avoid discussing clients publicly, and use secure electronic systems when needed. Confidentiality may only be broken when legally required. Protecting client information demonstrates professionalism, ethics, and respect for client privacy. Please take a few minutes to watch this HIPAA compliance training video before proceeding to the next section of this presentation.
HIPAA compliance training for massage therapists. Introduction. As healthcare professionals, massage therapists have a legal and ethical responsibility to protect client privacy and confidentiality. Understanding HIPAA requirements helps protect clients, maintain trust, and ensure compliance with federal regulations. This training provides an overview of HIPAA and its application within massage therapy practice. What is HIPAA? HIPAA stands for the Health Insurance Portability and Accountability Act of 1996. HIPAA was created to protect patient privacy, safeguard health information, establish standards for handling medical records, prevent unauthorized disclosure of personal health information. HIPAA applies to healthcare providers and organizations that create, receive, store, or transmit protected health information. What is protected health information, PHI? Protected health information, or PHI, is any information that can identify a client and relates to their health, healthcare services, or payment for healthcare services. Examples of PHI include client name, address, phone number, email address, date of birth, medical history, health conditions, medications, treatment notes, intake forms, SOAP notes, appointment records, and insurance information. PHI may exist in paper, electronic, verbal, photographic, or digital formats. Confidentiality and massage therapy. Clients trust massage therapists with personal and sensitive information. Massage therapists must maintain confidentiality, respect client privacy, protect client records, discuss client information only when appropriate, and follow clinic policies and HIPAA requirements. Confidentiality extends beyond the treatment room and continues even after treatment has ended. Handling client documentation. All client records should be complete, accurate, professional, legible, and securely stored. Examples of client documentation include intake forms, consent forms, health histories, SOAP notes, progress notes, and incident reports. Client records should never be left unattended in public areas. Storage of client records. Paper records should be stored in locked cabinets, kept in secure areas, and accessible only to authorized personnel. Electronic records should be password protected, stored on secure systems, and accessed only by authorized individuals. Students should never remove client records from the clinic without authorization. Verbal conversations and HIPAA. HIPAA applies not only to written records but also to conversations. Avoid discussing client information in hallways, waiting rooms, at the front desk, in restaurants, on social media, or with family members and friends. Client information should only be discussed in private and professional settings. Sharing information within the same clinic. Healthcare providers working together within the same clinic may share relevant client information when necessary for treatment, payment, or healthcare operations. Examples include consulting a supervising therapist, discussing treatment modifications, and reviewing SOAP notes with authorized clinic personnel. Only information necessary for client care should be shared. This is often referred to as the minimum necessary rule. Sharing information with other healthcare providers. Client information may be shared with physicians, chiropractors, physical therapists, occupational therapists, nurses, and mental health professionals. However, Client authorization is generally required before releasing information to outside providers. Authorization should be written, be signed by the client, clearly identify what information may be released, and identify who may receive the information. Sharing information with family members or friends. Family members, spouses, employers, and friends do not automatically have access to client information. Even if someone is paying for treatment, client information should not be disclosed without proper client authorization. Always obtain written permission before discussing a client's health information with non-authorized individuals. Social media and HIPAA. Massage therapists should never post client information online, share client photographs without written authorization, discuss client cases publicly, reveal identifying details on social media. Even if a client's name is omitted, enough information may still identify the individual. When in doubt, do not post. When is disclosure of PHI legally permitted? Certain situations allow or require disclosure of PHI without client authorization. Examples may include court orders, legal subpoenas, mandatory reporting requirements, public health reporting, certain law enforcement requests, and situations involving immediate threats to safety. Massage therapists should consult supervisors, clinic policies, or legal counsel when uncertain. HIPAA violations. Examples of HIPAA violations include leaving records unattended, discussing clients in public areas, sharing information with unauthorized individuals, accessing records without authorization, posting client information online, and improper disposal of records. Violations may result in disciplinary action, employment consequences, civil penalties, and legal liability. Best practices for massage therapists. Always protect client privacy. Store records securely. Lock computers when unattended. Use strong passwords. Verify authorization before releasing records. Follow clinic policies. Discuss clients only with authorized personnel, and maintain professionalism at all times. Knowledge check.
1.
What does HIPAA stand for?
2.
What is protected health information?
3.
Can client information be discussed in a waiting room?
4.
What is the minimum necessary rule?
5.
When is written authorization generally required?
6.
Can a therapist discuss a client's condition with a spouse without permission?
7.
What are examples of HIPAA violations?
8.
How should client records be stored?
9.
When may PHI be legally disclosed without authorization?
10.
Why is confidentiality important in massage therapy? In conclusion, protecting client privacy is both a legal responsibility and a professional obligation. By following HIPAA guidelines, massage therapists help maintain client trust, protect sensitive information, and provide safe and ethical healthcare services. Remember, when in doubt, protect the client's privacy and seek guidance before sharing information.
Professional appearance and dress code. Students must wear clean black scrubs, maintain good hygiene, avoid strong scents, keep nails trimmed, wear appropriate shoes, and maintain professional appearance. Professional appearance contributes to client comfort, infection control, professionalism, and therapeutic trust. Code of conduct. Students are expected to demonstrate professionalism, respect for confidentiality, maintain professional boundaries, and communicate respectfully. Students may not attend clinic under the influence of drugs or alcohol or with acute or highly contagious diseases. Students are required to notify the school if he or she is unable to attend a clinical day within 24 hours prior to the related clinical schedule. Professional behavior helps maintain a safe and respectful learning environment. Classroom and clinical preparation. During lecture days, students are required to wear top and bottom black scrubs and bring at least one set of clean twin sheets. During clinical days, students are required to wear top and bottom black scrubs, bring 3 sets of clean twin sheets, and other required supplies if needed. Students who are unprepared may receive an absence. Preparation and professionalism are important parts of clinical training. Healthcare communication and referrals. Fully licensed massage therapists may communicate with physicians, chiropractors, physical and occupational therapists, nurses, and mental health professionals. Client authorization is generally required before sharing records or treatment information. Professional communication supports continuity of care and client safety. Clinical case studies. Students should learn to identify contraindications, treatment goals, pressure modifications, home care recommendations, and reassessment needs. Examples may include office-related neck tension due to occupational reasons, elderly clients, and athlete recovery. Case studies help students apply clinical reasoning skills to real-world situations. You did a great job by listening to and watching this presentation. As a chapter summary, we want to make sure you properly understood treatment planning that included communication, assessment, documentation, ethics, professionalism, and clinical reasoning. Always remember that professional communication and informed consent are essential parts of safe massage therapy practice. Massage therapists must always prioritize client safety, professionalism, confidentiality, and ethical conduct. In closing, this concludes Chapter 10, Treatment Planning, Clinical Assessment, Intake, Consent, and Documentation. Please continue reviewing SOAP note procedures, intake forms, contraindications, clinic policies, and professional communication skills. These concepts are essential as you prepare for clinical practice and professional massage therapy settings. The following questions are designed to help reinforce important concepts related to treatment planning, client communication, contraindications, documentation, professionalism, and clinical procedures. Choose the best answer for each question. Question 1. Which of the following is considered part of the treatment planning process? A. Performing surgery. B. Client assessment and documentation. C. Prescribing medications. D. Diagnosing diseases. Correct answer. B. Client assessment and documentation. Question 2. Why is documentation important in massage therapy? A. It replaces treatment planning. B. It helps track client progress and provides legal protection. C. It allows therapists to diagnose conditions. D. It eliminates the need for intake forms. Correct answer. B. It helps track client progress and provides legal protection. Question 3. Which of the following should occur in the treatment room and not in the reception area? A. Scheduling appointments. B. Discussing confidential client health information. C. Greeting clients. D. Providing towels and linens. Correct answer. B. Discussing confidential client health information. Question 4. What should a student say before leaving the treatment room for the client to prepare? A. Please wait here until I return. B. Remove all clothing. C. Disrobe to your comfort level, cover yourself with the top sheet, and place your face in the face rest. D. Lie however you feel comfortable. Correct answer. C. Disrobe to your comfort level, cover yourself with the top sheet, and place your face in the face rest. Question 5. Which of the following is part of professional communication during a massage session? A. Discussing political opinions. B. Checking pressure and comfort levels. C. Discussing other clients. D. Excessive personal sharing. Correct answer. B. Checking pressure and comfort levels. Question 6. Which of the following is considered outside the massage therapist scope of practice? A. Providing stretching. B. Using hydrotherapy applications. C. Diagnosing diseases. D. Performing massage therapy. Correct answer. C. Diagnosing diseases. Question 7. Which condition may require massage treatment to be postponed? A. Mild muscle tightness. B. Fever and infection. C. Dry skin. D. Mild stress. Correct answer. B. Fever and infection. Question 8. In the OPPQRST system, what does the letter Q represent? A. Quantity. B. Quickness. C. Quality. D. Questioning. Correct answer. C. Quality. Question 9. What does SOAP documentation stand for? A. Safety, observation, analysis, prevention. B. Subjective, objective assessment plan. C. Stretching, observation, application, procedure. D. Subjective, organization, assessment, prevention. Correct answer. B. Subjective, objective assessment plan. Question 10. Which of the following is part of the school's dress code policy? A. Open-toed sandals. B. Strong scented perfume. C. Clean black scrubs. D. Artificial nails. Correct answer. C. Clean black scrubs. Thank you and congratulations on completing Chapter 10. Thank you for taking the time to review this important chapter on professional massage therapy procedures, communication, clinical documentation, and client care. The concepts presented in this chapter are essential components of safe, ethical, and effective massage therapy practice. As you continue your training, remember that professionalism, communication, assessment skills, and proper documentation are just as important as hands-on treatment techniques. Thank you for your dedication and commitment to becoming a professional massage therapist.